today I wanted to address healthcare workers because I feel that there's a lot of ignorant people out there that are putting people's lives at risk. From my own experience, 2 days ago, I went to work. One of my jobs is working as a healthcare worker, and I went into work and I found 3 members of staffs who were really, really ill. If you hear the sound of their coughs, you'll be worried. And of course, I was mindful of their coughing, and I was wondering why they were allowed to work when they were coughing, really, really horribly like that. So I took precautions. I was thinking, let me inform the manager so that I can make them aware that this has not gone unnoticed to the other members of staff. And I thought, let me watch how they're going to deal with their hygiene as well. Now, one of the ladies that I was working with, she was coughing, and whenever she was coughing, she would cough on the back of her hand. She would just put the back of her hand like on her mouth, like really horrible coughs. Then I saw that she was administering the patient's medicine and she didn't wash her hands and she didn't use gloves. And that's when I became really angry, and I said, no, I need to go and inform the manager about this. So I went to speak to the manager. I said, 3 members of staff are coughing. And she tried to put my mind at ease by saying, oh no, they've been checked out, blah, blah, blah. I said, the government clearly gave guidelines that anybody who is experiencing these symptoms, such as flu-like symptoms and coughing, should self-isolate. So I was wondering, why would they even come to work and not self-isolate themselves when they have one of these symptoms clearly? So the manager knew I wasn't going to take a back stand from this. So she decided to go and call a staff, kind of like a staff meeting. So she called the 3 people who were coughing to a meeting and said and addressed to them that I made a complaint because one of them was coughing and was not washing her hands after she coughed on the back of her hand before administering a patient's medicine. Yeah. So after my manager told them, this group of girls and their friends, they came towards me, and they walked in front of me, and they were making like snidey comments like, oh, I had coronavirus, I'm sure I wouldn't be able to work, I'll be so ill and I wouldn't even make it to work. And I was thinking, how ignorant could you be to even make that kind of statement? Because some people have this virus and they don't even have any symptoms. Okay, people like Idris Elba, they have this disease and they didn't even know about it because they didn't show any symptoms. So it's very, very ignorant for you to make that kind of comment, especially when you are dealing with vulnerable people. Do you understand? So I went and said to her, excuse me, if you want to talk to me, you come and talk in my face. And she went, no, it's just that I don't understand why you would go and complain. I said, because I saw you coughing on the back of your hand, and then I didn't tell, before that moment, I didn't tell the manager who it was that coughed on the back of their hands before giving a patient their medicine. Yeah. So she basically wanted to out herself, because if you're going to come at me, now you're going to be exposed. So I said, I'm going to say who it was that coughed on the back of their hands and then now did not wash their hands to give the patient their medicine. Do you understand? We as healthcare workers, we have a duty of care. And this come in whether written or not. I know some of you are out there doing this job for money, but be very mindful that these people, these vulnerable people that you're working with, some of them, they have mothers, some of them, they have sisters, they have brothers, they're someone's auntie, someone's mom, someone's dad. Okay? They matter to other people, just like your children matter to you. They matter to other people. So if you're going to do this for just the money, all well and done, but don't come and do it whilst putting people's lives at risk. This made me really, really angry. Do you understand? Because I know there's a lot of healthcare workers out there that are doing it for the money. But this is more than that right now. We are in a critical situation where we have a disease that we have no cure for. So you can't put other people's life at risk. Vulnerable people like patients, these people don't get to choose who they work with. They don't get to choose it. That's why they're more vulnerable. They don't choose us. So they just get whatever they get. So if you're going to come and treat them, if you're going to come and care for them, make sure you're in a good, healthy condition. Because at the end of the day, you are not helping those people. If you're sick and you're going to look after sick people, it makes no sense at all. It makes no sense, because at the end of the day, these people are vulnerable. Their lives are more at risk than any of us, because they already have a weak immune system, because that's why they are our patients. Okay, so you going out there and working when you have got even a slight cough. This is the other thing I can't understand. 2 weeks ago, I had a mild symptom, and I'm not talking about hard symptoms. I just had a mild, just irritated ears, itchy throat and a little bit of runny nose, and I did not go to work for a week. And because I didn't know how I'm going to get better, I didn't even say to my work that I was sick. I just took one day at a time. So when they asked me, are you going to come tomorrow? I'm like, I'm not sure yet. Let's see how I get on. So I did that. So in the end, I was not entitled to a sick pay because I did not inform them in time. And I didn't even go to my doctor because the doctors right now, they're not taking patients. So at the end of the day, I couldn't go to my GP and get a sick note to get paid for my work, to be able to prove to work that I was sick. You understand? But I didn't feel that I was that sick enough for me to even get a sick note. So I just said, I will just follow the guidelines that the government has set out. And I stayed indoors for 7 days. I didn't go to work. Do you understand? And to come to work and to find someone coughing really badly, I couldn't understand why that person would even come to work. I know we need money right now, but that money is not worth putting other people's life at risk. These are people that other people care about and that we should care about because we have a duty of care as healthcare workers. That is our number one priority, duty of care. Do you understand? We have that, and we must obey the law. We must obey the rules. We must follow the guidelines that have been set out in regards to this coronavirus, because at the end of the day, we can't keep going and putting other people's life at risk. Do you understand? So if you're a healthcare worker and you have any of these symptoms, please go and get some kind of treatment. Or if your symptoms are very mild, stay and self-isolate yourself. It's not fair to go to work and put other people who already have a weak immune system to put them at risk of this disease. We already lost one patient last week. Do you understand? And they want to keep all of that hush, hush, hush. They didn't want anybody to talk about it. And then one of the manager's husband suddenly died of pneumonia last weekend. Do you understand? Everything is adding up because they're not keeping an eye on people who are coming to work. They're not doing any checks on, people are desperate to have staffs. So they will just take any member of staff, even if they're sick. And this is the sickest thing about it. So the government needs to get up, because I'm a healthcare worker and I'm here to say to the government, the staff members are brought into work and the managers do not care whether they have any of these symptoms. Because for some, not one, not two, 3 people coughing very horribly. I'm not talking about this normal cough. I'm talking about the cough that if they cough, you just even think, oh my God, even if it was a normal flu, you'll be in fear of getting it, let alone if there's this virus going on. So it obviously shows that there's healthcare managers who are not following the guidelines, surely. They're not following the guidelines. And this makes me angry because they could get people to work from agency, people who are healthy, but they're not doing that. So the government needs to do something about it to protect those that are vulnerable. I don't know what's going on and I don't know what the plan is. Do you understand? But I'm getting really pissed off about this whole thing, because the fact that people's lives are not being put into consideration, that people's lives are not being prioritized to save people's life, is becoming very worrying and very concerning. And it's making me think, are they doing this because they want people to die? Because at the end of the day, it makes no sense. You are working with vulnerable patients. So why would you bring in an employee who is carrying one of the symptoms of the coronavirus, which is coughing, and not just any normal cough? This is a very horrible and disgusting cough, one that it feels like the whole building is coming down when they cough, and you're allowing those people to be around the most vulnerable people. It makes you think, are they really trying to kill people or something? Because it makes no sense to me. I don't understand it, because the kind of job that I do, they have no problem with staff because they can always get agency staff. Yes, it will cost them more, but what is more when it comes to someone's life? You can't put a price on someone's life. So we need to get healthcare workers who are healthy and fit to work to come to work. If you know you're not feeling well, stay in your house and don't come and infect other people. Do you understand? Because at the end of the day, you are there to care for people. How are you going to come and care for someone if you're sick yourself? You're not caring for them. You're there to destroy them. So don't think that you're doing this amazing job telling yourself, oh, I'm a frontline healthcare worker, I'm going to work even though I'm sick. No, you're not helping anybody. You're putting people's lives at risk, and you should be even put in prison for doing that, because that's manslaughter. You're working with patients who, most of them have very weak immune systems. Some of them, they can't even swallow solid foods. They have to eat food that has been liquidized because of how weak their immune system are. So how dare you come to work with people like that when you're sick? How dare you? So the government needs to do something about this, because there's managers out there who don't care about the lives of their patients, and so they're bringing in sick staff members who they should be there to care for them, but they're there to destroy these people's lives. So I'm pleading with the UK government, because this happened in the UK. I'm pleading with the UK government to make sure that these mistakes are not made, because at the end of the day, we are working with vulnerable people. And these people are the first ones that it will affect if they're exposed to this virus. So we can't have members of staff that are coughing, especially coughing. Because when you cough, you can't control it sometimes. What if you're there doing something for a patient and then you cough? They have nothing to protect themselves. They don't have the mask. They're not the ones provided with the mask. They're not the ones provided with the gloves. And some of them, they can't even go to the toilet, let alone wash their hands. So how are you protecting those people if you're bringing in staff that are coughing on them, coughing on their food, coughing on their medications? So please, let's be mindful of other people. Every life is valuable. Every life is valuable. And if you're working in healthcare, saving lives should be your main priority, not to take it. So if you're sick, stay at home. Stay at home, because the government has already announced that there's going to be help for people who are going to be off work. So you have no excuses to say, oh, well, what am I going to do for money? You have no excuses. I'm sorry, you have no excuses. There's no more cinemas. There's no more going out. So everything you need right now is just the food in your house. I'm sorry. And I would like to see what landlord would come and evict you at this time. And also, you're getting money, you're getting benefits. The government has announced that it will help workers who are being laid off, let alone who are sick, working in the front line. You are going to get help. So why would you not take precautions and try and save other people's lives? That's your job. Your job is there so that you can save lives, not to destroy lives. So be mindful. You're not a hero if you're sick and go to work. You're not a hero, especially in healthcare. You are a devil, and you are a killer, because you're, at the end of the day, you don't know whether you're carrying this and you're going out there and exposing it to other people. You're not being a hero by going to work when you're sick and working with sick people at this very moment of time, where the sick are the most vulnerable for this disease, and also elderly people. All right? So please be mindful and take this message very, very seriously. If I see anybody at work, I didn't go to work yesterday and today. If I see anybody at work, my next move is not to call my manager and discuss it again. I'll be calling the officials, to come and deal with it, because this is a crime. It is a crime against humanity. And it is a crime to put someone's life at risk at this moment of time, when we're all worried about this illness that nobody has a cure for. We don't have a cure for it. The best thing we can do is take precautions. And the best precautions you can do to help other people would be to self-isolate yourself if you're experiencing any of these diseases. Because at the end of the day, the people that you're going to care for, the people that you're going to give medications and all of that, those people, they matter too. Even if they don't matter to you, they matter to someone. Yeah, just like your family members, just like your friends matter to you, they also matter to someone like that. So don't put their lives at risk. Please take precautions.